Hi, Dr. Vogel. I'm presented with an 8-month-old miniature poodle with a right forelimb mid-shaft fracture of the radius and ulna. I would like to ask your opinion on what are the best options to treat this fracture.
So you have several options. If you look here at your radiograph, you have a transverse fracture of the radius and ulna, and you have a reasonable amount of bone above and below. So the primary recommendation for fixation would be reduction and fixation with the plate and screws. Alternatively, you could consider some form of external skeletal fixation, either a biplanar external skeletal fixator or a circular external skeletal fixator, both of which would work well. The third option would be just to go with external coaptation. However, in this type of fracture, the risk of non-union or malunion is fairly high.
The client is budget concerned as well as working most of the time, so she would like to treat this fracture with the least complication. What is the most sensible option for this?
So you have two ways to go. As far as budget-wise, an external fixator is going to be less expensive than plate and screws. However, if you want something that's more set it and forget it, then I would recommend plate and screw fixation. An external fixator is going to require some effort on the client's part as far as cleaning pin tracks and making sure everything stays okay, whereas with the plate and screws, they can pretty much just leave well enough alone.
As you see from the X-ray, there is a fracture in the radius as well as the ulna. Do we need to fix both the radius and the ulna?
So the weight-bearing bone of the forearm is the radius. The ulna is just a lever arm. And so once the radius is adequately stabilized, the ulna will heal just fine on its own.
And what equipment is needed for the surgery?
So what you're going to need to have is appropriately sized reduction forceps, as well as, if we're talking about plate and screws, you need obviously a drill, the appropriately sized plate and screws. As far as an external fixator, ideally a positive profile threaded pins, or you could get away with smooth pins. And if we're going the circular fixator route, then all we need are K-wires. Again, you're going to need a drill of some sort for all of these types of fixation.
Can you walk us through the procedures of doing the surgery?
You absolutely can do that. If you would like to schedule a time for me to assist you, all you need to do is to go to our website, and I can send you that link right now. And what you do is just schedule a block of time that I have open, and I can be there with you and walk you through this step by step.
How often do we need to recheck this dog, and what sort of complication do we need to be prepared of?
A little bit depends on how we go about and repair this fracture, but typically you're looking at suture removal in about 10 days, and then we just do x-rays every 3 to 4 weeks until this fracture is healed. As far as complications, one of the things that can occur is resorption of the bone under a plate and screws or with extremely heavy external coaptation. So what I would recommend is that we go with an appropriately sized implant and just a light splint postoperatively for 2 to 3 weeks. We certainly can see infection. If we do get an infection that's involving an implant, we need to treat that with oral antibiotics until the fracture is healed, and then that implant will need to be removed. If we don't have good owner compliance, certainly we can have bent plates, broken screws, things like that. As far as an external fixator goes, they're all, again, similar complications. However, we can see pin tract infections developing. Again, we just treat those with antibiotics and maintenance around the pins until the fracture is healed, and then we remove the implants.
Thank you very much, Dr. Vogel.